This morning we heard from all our speakers really, the need for change, the need for something new, the way to do something different. One of the things I think I also heard was that we are in place now, an opportunity now, to think about how that happens. Because many of us are committed to transformation, but many of us still are thinking about rearranging chairs on our personal and our organisational Titanics. I think for me, it's about today and this afternoon is the challenge about saying, what would that new Waka look like? What would those new deck chairs look like? Not the same ones patched up. And so that for me is one of the challenges. I also heard this morning both Ashley and Robyn talk about the Treaty of Waitangi, the equity issue, and I know for many of us we've heard in Te Ara Oranga various voices, Pacifica, lived experience, but for me one of the challenges is Māori. Māori have been mobilising for a long time saying, no, let's move into a new space, let's actually integrate and move Māori into that space. And it hasn't been happening. But now is an opportunity to say, let's act on some of that. And again, this afternoon is about thinking outside the box, outside our personal comfort zones. So as I say, Te Huriwai, I do addiction stuff. I'm with Te Rau Ora, which for many of you used to be Te Rau Matatini. We're about strengthening well-being and health, particularly for Māori. And so it's my privilege to be here and working with Fraser and with you to think about what our tomorrow might be like. Aha ko I te noho, you're going to hear more from me later on, but I just want to hand it over to Fraser now to introduce what we're going to be doing today. Our direction of travel really is some presentations, which is covering a bit of the context and content of what we hope is a model of how to make those transformations happen. Plus, you all get to work at your tables together to work on some exercises which hopefully will reinforce some of the kōrero that we're going to be talking about during the day. By the end of the afternoon, we want to get to a place where not only have you had an experience maybe of thinking differently about how the world might be, how to achieve that, but also giving us some feedback as well. I think everyone talks about co-design. I think, oh, it's co-design. At the end of it, it's about end user. What we're talking about today is you are the end user. For you, your end users will be those who access your services. But for us, it's important to get your feedback about what we have to share this afternoon. So again, aha ko I te noiho, ka nui te mihi ki a koutou, nā reira tēnā koutou, tēnā koutou. And now, without further ado, can I introduce to you my brother in crime.
Te hei mauri ora no Oranga ki te whai au ki te ao marama ki a rātou mā haere atu rā. Ki Ranginui Runga ki Papatūnu kua takato nei tino rā koroa. No reire ki a tātou tipina mātua rātou ki a rātou haere atu rā. No kotorana ahau ko Clan Fraser oku iwi ki te taha o tōku papa ko te Glen Gordon, ki te taha o tōku tipina wahine ko te Glen MacDonald. I nei noho ana ahau kei wanginui ata waka a maui te teiti ata maunga taki timu, tēnā rā koutou katoa. Ka mihi ki a koutou e tēnei wā, kia tautu rangi Māori e ki hoho e te rango ko tai a tātou katoa. Tēnā koutou, tēnā rā koutou katoa. Thank you very much. I just need to acknowledge our other partners in crime, Ashley Koning at the back, at the side there, who's been doing the tech this morning for the streamed stuff. Wendy Donaldson, who's part of the team as well. And I want to say, to start with, what we're presenting, the workshopping, is a framework, if you like, for change, on the principle that we need to change how we change. We're not following a traditional plan in terms of developing the workshop. The traditional plan would be that we do a lot of planning and consultation. I was thinking this morning that the word consult is a bit similar to insult, and probably fairly apt. And then lots of development, and then coming up with this plan, and then working out how to implement it. What we're doing is we've come up with, done a lot of literature review to get up to speed with what's being said in this sector, coming up with an idea and putting it out there for consultation. And this is the first real consultation. Think of it as a bit like it's a plasticine model. You get to mould it. It's wrong. It's going to change a lot with the feedback. So really that's the process. in terms of, I guess, the essence of it, increasingly there's been awareness that the systems that we're dealing with are complex and volatile systems, and that they basically require a different way of working with them than the traditional mechanistic systems approach. And so that's what's threading through a lot of what we're going to say. Need to say that a complex systems view of the world is quite different from what a lot of people are used to. The concepts are quite challenging. For example, cause and effect doesn't exist in the complex world. And so it's actually a bit of a paradigm shift. A lot of people are uncomfortable, especially people who are good at real detail thinking. Other people are more comfortable with that way of thinking. What I encourage you to do is, rather than have a negative reaction to concepts that are challenging and don't seem to fit with your worldview, sit with them and explore them, reflect, and if you want to and need to, still reject them, but give them a chance, right? Because there is a lot of evidence about how to work with complex systems, which we need to be bringing into our way of thinking. So I'm going to make a brief introduction about the model. Then we're going to talk about the nature of models that we've reviewed and looked at, and there's some real problems with the evidence base around some of the models. Coming from a medical background, my idea of evidence base is completely different from what it is in implementation science, where the evidence is really thin, and where a lot of it is just opinion of experts. Got to talk about the nature of complex systems, present an outline of the framework, work through an application of the framework, and with that we've got 3 exercises that we're going to get you to do, just thinking about complex systems side of things, and starting to think about what you do about them, because there's been quite a bit of discourse about the difference between the 2 systems, but we need to be starting to talk now about what do you do about them, how do you manage them. So this is the framework, EPIC, named after Ashley Koenig's, one of his favourite beers. We've tried really hard to fit our thoughts into this epic, but no. So basically these are the frameworks, the phases that most models use. Some use 5 or 6, most use 3. Some use 3, but most of them use 4. We talk about pre-change, and notice that that's what Robyn was talking about in terms of preparation or readiness for change. It's what you do before you have to implement a change. Then there's the exploration phase, thinking about changing, the planning phase, planning to change, implementing change, and then continuation, or what you do in terms of sustaining. We like continuation because a lot of the, because it fits with EPIC. No, because a lot of the things that you're doing to sustain change, you should have already done earlier. They are key things that you need to do in exploration, planning, and implementation stages. And then the idea is scaling up. How do you take a change that's worked in one place and start to make it effective when you implement it in other places? And then there's cross-cutting issues. For each of those phases, we think about leadership, collaboration, communication, training, evaluation, motivation, resistance, and resources as plans that you need to have at each phase. And the key thing is, for us, that there are 2 different types of systems. Some people go 4 or 5, but there are 2 different kinds of systems. They're what we call linear systems. Those are kind of like mechanistic systems, fairly predictable. And when we need to work with them, we need experts, and we would call those complicated systems. There's also simple systems. We don't have many of those in health. But they're complicated systems, and they're predictable, and they're repeatable. And on the other hand, there's complex systems, and they are the organic, fairly unpredictable, volatile systems. One would argue that most systems in health are complex in nature, and to stress that there we're talking about not it's complicated like it's complex, like it's hard, but there are different concepts about different kinds of systems, and we'll go into that a bit more. Going to mainly talk about the complex side of things, because on the complicated side of things, that's pretty much traditional leadership and management. We'll be fine for those kind of systems, okay? And so what we're going to explore today is the complex side. And on the complex side, you've got planning. That's not planning your intervention or planning your change, that's planning your process, right? At that phase, you're not getting into what is the change we're going to do and how do we implement that change. You go into what's the process, let's move on into actually doing it. And then you have an iterative cycle, which is the implementation phase, when you try something, you evaluate it, you adjust it, you try it again, and you do that reasonably quickly. So it's none of this 12 months of planning, and then another 6 months of planning. and then 3 months and you've forgotten what you planned, and so you start planning again, and then finally you might do something that you worked out. It's do something, and we call that a safe to fail trial. It's a trial that isn't going to bring your system down, so it can afford to fail, because it probably will half the time. So you try it, you evaluate it, you change it, you try it again. If it works, you do more of it. If it doesn't work, you do less of it. It's really simple and pragmatic. And then continuation is probably pretty much the same for both types of systems. Traditionally, one of the traditional systems has really been that at the top you have the ideas, which then filter through this hierarchical system, and the people put it into practice at the bottom of the hierarchy. And that's fine for complicated systems. There's probably better ways of doing that, but it will work for complicated systems. With complex systems, your innovation comes from the periphery. It's a key point in complex systems that your periphery, or your system, is highly sensitive to its context, to its environment. And it's where the edges of your system rub up against the environment that you get creativity happening and people making decisions about how you fix things, how you change things. And so your innovation comes from the edges, as opposed to a more complicated hierarchical system where your innovation tends to come from some central point. There's a lot of change happening in New Zealand which introduces some complexity principles. Our point is you probably need to use more of them. You add a few complexity principles into your change and you'll get a little bit of change, and it might still end up being messy. So we need to do more of them. But there's, in our experience and observation, there's a disconnect between the top and the periphery, or what is thought of in a traditional system as being the periphery in a top-down system. Where, for example, you might have your clinical leaders, your clinical managers with really good ideas. They're bringing in co-design. They're teaching their project managers about co-design, but right down at the clinical manager level, the practitioner, health worker level. I was going to say clinician. I like clinician. Lots of people hate clinician. I think I'm a clinician. Others think they're not clinicians. I'm trying to find the right word. If anyone's got a really good word for those people that work face-to-face with tangata whaiora to try and help them improve their quality of life, let me know. I'm trying to find that word that doesn't insult me or other people or everyone. Workers are different. Kai mahi was suggested, but that's got a whole lot of different, So I'm forced to use old language, and I appreciate it's not really suitable sometimes, but if I do trip up, just excuse me. It's just because I'm a bit older, and I'm a doctor. I can't, not so adjacent. So there is this disconnect, and so what we're aiming for is we're hoping that those of you who know about complex systems will kind of help inform the whole process, and those who don't will learn something. But what we really want to do is help the practitioners, the health workers at the edge, and those managers managing those services to understand about complex principles so they can put them into practice. Because again, what happens is you get some complexity principles at the top filtering down, and it doesn't really get down to your clinical services or your health services, all right? And so we think that the people at that level need this information to know how to actually work with services effectively and transfer those ideas that are coming through the system effectively. So the aim is just that, as I said. We want it to be simple and usable, evidence-based, able to be self-directed, so you don't need some central team going around and teaching this to everybody, because it's just not going to work and it's not going to get out there enough. Self-directed information. And resources that are in the public domain, because one of the problems with a lot of the models is they're proprietary and they're being commodified. And so you've got to pay for them. You've got to pay to learn them. And actually, so you get a whole lot of models that are reinventions of previous models that some guru is promoting, change the language a bit, and you've got to pay for those. And we've got better things to do with our money and health, haven't we? All those things we're talking about changing to. So we're wanting to go for stuff that's in the public domain. In terms of evidence-based, as I said before, that's a real problem because there's not a huge amount of evidence in implementation science, and if there is, it's not replicated because it's about individual models, and even then it's only self-report. How many people do this? How many people do that? So where there is a lot of evidence is in complexity science and how complex systems work, how you manage complex systems, a whole range of different complex systems. So we're drawing on that reasonably heavily. And the process is identifying key models, as I've mentioned. We've developed 3 scenarios. If you've got advice about better ideas, that's fine. We're halfway through the initial process of throwing out my ideas and getting better ones. We want to present this, which is a prototype or a draft, for feedback and critique and changing, so everybody's involved in changing it. And the scenarios are these. So first of all, scenario 1, and you'll be working with these in the groups. Results of a national survey of consumers and clinicians have indicated that the care the majority of people seen in mental health services receive is not consistent with the recovery approach, despite the fact the Ministry have said recovery approach. Most people aren't getting a recovery coach. We don't know if that's true or not. That's just a proposition we're putting forward. Discussions in your region have led to a consensus that more should be done to deliver care that is consistent with recovery principles, and services have been challenged to work towards this goal. Your services senior leadership team has decided to embrace this direction. So that's the first scenario. Number 2, a community child and youth mental health service wants to implement a new model of care in which an evidence-based manualised psychotherapy is to be used by all staff for the treatment of depression. 3, your emergency department, concerned about rates of alcohol intoxication in people they see, decide to introduce alcohol screening, leading to an online intervention where appropriate for all clients. So if you don't like the scenarios, that's fine. Where we're going to use them is, which of these is complex versus which is complicated? Can you transfer one to the other? And how might you come up with interventions that are safe to fail? So encourage you not to get into, we don't like this scenario, we don't like those use of words or whatever. Give us advice afterwards, and we're happy to change them because we just come from one particular paradigm or 2, and there's lots of other paradigms, so happy to change them. But just think about the nature of that scenario. Is it complex? Is it complicated? That's the first exercise. Can you change from one to another? That's the second. How do you intervene with it? That's the third. So background, obviously, why? Well, because everyone's talking about change. You might be sick of change, but you can't avoid it. We've got an inquiry. There's been change suggested for a number of years, blueprint, rising to the challenge. It's all talking about the need for change. Unfortunately, and people say this, 70% of change efforts fail. Have you heard that? It's rubbish. It is. The original for that came from one study where somebody has quoted it over the past 10 years, and everyone's quoted the quote. Actually, when you look at the evidence, the rates of change failure are variable, really variable, depending on the nature of change. What it's telling us, though, is that change is really hard. We all sense that it's hard to change, and when we change, it's hard to do change properly, or how we want to. So that's the thing. Change is difficult. We need to change how we change because it hasn't been working. There are a whole lot of reasons with some evidence behind for why change fails. The first is a lack of alignment between services and community, between the different goals of a service, the policies and procedures and the goals of a service, the funding contracts. There's a whole lot of misalignment. And I think that's one of the major ones in our system, that we're not very well aligned to a set of common goals. There's others: insufficient resources, unrealistic expectations, failure to communicate reasons for change, conflicting agendas, lack of senior leadership support. These are all commonly said things. Our experience with trying to implement change for coexisting problems over the past probably 20 years, which we've failed at miserably. We haven't, but it's not gone how exactly we want it. And this is what we've been trying to promote over the last 8 years or so, is Te Areare o Te Oranga, is that, well, we think we're getting some good traction with practitioners, but there's been a drop-off, there's been a kickback over the past couple of years, and it's kind of lost its influence and potency. We think it's really useful because its prime drivers are around person-centred, whānau-centred care and well-being, orientated care and integrated care, and those are really important principles. But thinking about what the main drivers are, and I think these are really important things. First of all, we've taken the foot off the pedal. We've kind of stopped promoting it quite so much, and I think that's because we had, in the alcohol and drug sector, which was driving it, SACAT, the new Substance and Addiction Compulsory Assessment and Treatment Act, which we needed to help the ministry put a lot of effort into in terms of promoting and upskilling the workforce. And in doing that, a lot of money was going to that, and we sort of stopped promoting CEP. And so when you stop promoting it, even 8 years down the track, people sort of revert back to what they were doing. The second thing is conflict and goals, and I think this is a really crucial issue. It's one that people tend to avoid and put into two basket, but sometimes they're really explicit, but often they're implicit. One example which we've now become more aware of is the conflict between environmentalism, save the planet, and the cost of that. Right? And that's a major conflict which really stops, big companies do not want to lose profits, and therefore it's really difficult to get change around sustaining those kind of changes. Another one is the top-down and bottom-up control issue. Complex systems demand a bottom-up approach, and it's really difficult to encourage people in leadership and management positions to relinquish some of their control. And that's kind of understandable, because in those positions, you're responsible, and so you want to make sure things happen, right? But there are times when you need a little bit of control to be relinquished, right? The leadership is from behind rather than in front, and it's hard to get that change, and there's conflicting principles about that. The big one for CEP we thought was recovery versus disease orientation, that when you talk to people, they'll all talk recovery and wellbeing approaches, but when you look at what's happening in their work and the subtle thoughts driving it, there is a large body of people who focus on treating disease and a large body of people who focus on enhancing quality of life and recovery principles. And it's the conflict between those ideas that make it really difficult to get change. The medical model, if you like, the disease orientation model, we like to kind of go, oh, that's old-fashioned, we've all changed, even us doctors. But actually it's alive and well, implicitly in some of the assumptions underpinning what you do. So that's a significant barrier. One with CEP, individual versus social wellbeing. When we have trouble communicating with corrections, part of it is because we're looking at trying to promote individual and whānau wellbeing. Corrections don't care about that. Underneath it all, their job is to protect society, right? Not to help enhance the quality of life of the inmates, right? So we've got different approaches, different goals. Within alcohol and drug, 10 years, 15, 20 years ago, we had this big battle between harm reduction and abstinence approaches, right? Big conflict that stopped change happening. All of these things are resolvable when you actually bring them up. So, for example, the whole harm reduction and abstinence debate was solved really, really quickly when people realised that abstinence is just one part of harm reduction. Yeah. Social wellbeing and individual wellbeing, well, you get social wellbeing often and partly by improving the wellbeing of individuals and their relationships. So they're not either or, but because they're implicit and we don't talk about them, they can become conflict and they stop things changing. And the other big thing is treating the complex as complicated. When you use traditional approaches for complex systems, you get rubbish. Oh, sometimes you get really good results. It's pure chance. And often you'll get really bad results, right? And so we need a different way of working with complex systems. In terms of the models, there are hundreds of different models. We looked at a number of them. A lot of the models kind of don't have any evidence. They're Guru's approach. Kotter's model, which is a really popular one, really has no evidence for it other than his opinion. But his opinion, he's an expert, so. But there's no research evidence to support his conjectures. And as I said before, most of them are proprietary or commodified. They're focusing on differences, right? So my model does this. It's different from everyone else's model, so you need to pay me to come and teach you to use my model. That's the kind of approach most of them got. And we get different language being used for exactly the same concepts. So now we're getting a switch from resistance to motivation, which basic when you read what it's about, they're about the same thing. It's just someone's model's now talking about motivation, which is a point of difference, which isn't really, but it sounds like it. None of them cite their sources. They're all copying off each other and not giving any credit to other models. So it's all about my model's different, right? And as I said, there's all, well, I didn't say, I'm going to say now, there are different versions of models. So we talk about PDSA model, for example, and that's quite a useful model, especially for complicated systems, but it's 90 years old. So if you use a PDSA model, when did you start to learn about it? Because the newer PDSA models and some models have thrown out the idea of planning. So PDSA is about plan where you want to get to and how you're going to get there and then do it. The new models go, you can't really do that, so we're just going to do it, right? That's great for complex systems, but it's a PDSA model, but it's not the same PDSA model as someone 3 years ago was using. Same with co-design. There are a whole lot of different interpretations of co-design. So when we talk co-design, we need to go, what is it we're talking about? That's partly what we wanted to do, and I kind of liken it to those of you who work as a practitioners to what we get in the psychotherapy and the treatment of borderline personality disorder, if you'll let me use a diagnosis there to make the point, that there are at least 6 evidence-based treatments that seem equally effective. In randomised controlled trials, comparing them to treatment as usual, it gets awkward because the more recent randomised controlled trials say that treatment as usual is as effective as those as well, but we'll just ignore that. And they're all quite different. So you've got mentalisation-based treatment, which is a sub-form of psychodynamic psychotherapy. You've got transference-focused treatment, which is a sub-form of psychodynamic psychotherapy, quite different from mentalisation-based. You've got cognitive behavioural therapy, you've got DBT, they're all equally effective. And what it is, it seems, is that there are 6 things that are common to all of them. Structure, relationship, validation, consistency, motivation, and mentalising. If you've got an intervention for borderline personality disorder that does those 6 things, it's likely to work. So you don't have to go for one particular model over other models. Right? What you do is you have to go for something that has those 6 things. And most models only look at part of the picture. Okay? Most models in terms of implementation science, they're only looking at part of the picture, so there's problems there. What we were really wanting to do is to try and work out what are those common things that need to be present for a model to work. So when we've got 150 models for planning, which are the ones that are likely to work because they cover those basic common factors? What was common? Initial stages that we looked at. So there's an exploration stage where a few people get together and think, what are we going to do about change? There's a planning stage where in a complicated system you might plan where it is you're going to get to and how you're going to get there. And in a complex system you're better off planning what the process you're going to use is, but understand that you're not going to get where you want to get to, so don't have a specific destination, just have a sense of direction. Right. You want more inclusive participation from tangata whaiora in treatment decisions, rather than doing a specific model that asks them to participate directly. Right. So rather than going for that outcome, you're going for, we want to be more inclusive. That's good enough. That's a sense of direction. It's good enough. It's all you need in a complex system. I'll move on from there. The models that we've kind of relied on, ADCAR from ProSci, which is a really good model for stress and communication, probably more appropriate as a whole model for complicated systems. But its frontline idea of the first thing you need to do with people you're working with and trying to change is to actually have them understand why you want to change. What are the reasons for change? You get into trouble if people don't know why you want to change. Right. Active implementation, the fixing model, which is the model Robyn was talking about that the Toronto crew are applying. It's a really, really good model. It's consistent with a lot of complex thinking. It's a difficult model. When Robyn brought the idea back, I started looking into it. It took me about 6 weeks to get my head around. Most people take a lot shorter, but still a significant amount of time. But your clinical managers and your practitioners who need to know about this, they're not going to sit there for 2 weeks or 3 weeks, or if they're like me, 6 weeks, trying to understand how this model works. They need something much simpler. So we're trying to strip that back a wee bit. The model I'm most wedded to and had my experience has been with is Cynefin, which is Snowden's model from the UK. You may have heard of. We'll go into that a little bit. There's also the IHI, Institute of Health Improvements approaches that we've drawn on to some extent, and some good ideas in Tamarack Institute. So those are kind of models that we've drawn on that seem to fit with the underlying need. So reminding you again of that's the model. Now I'm going to talk about complex systems, and this is going to be a little bit more sort of PowerPointy stuff and talking about it, but I think it's really important to get your head around and try and get a feel for. So if we look at complicated systems are linear, chain reaction type systems, mechanistic systems. A really good example is a car engine. Right. If it was simple, we'd all know exactly how to break it down and build it up again. I have no idea about car engines. I'm a car phobe, apart from driving one to get to work. But there are experts who know how to do this. Right? When my car breaks down, I take them to an expert. And the expert knows how to do this. And it's in a book, and it's pretty much Each part has its role to play, A to B to C to D to bang, your car engine fires and you drive. Right? Well, it's probably a bit more complicated than that, but it's a chain reaction, it's linear. That's a complicated system. Complex system is an ecosystem. Right? Quite different. And the characteristics of a complex system are, first of all, what it is there are multiple connections between the agents in the system, but interconnections between all the agents, or most of the agents, not just one to one to one. The elements in the system, the agents in the system can adapt. So when there's a change in context, they can adapt. Right. So when rainfall drops off in an ecosystem, different plants might grow, other plants might not grow. They adapt to the drying conditions. You know, evolution is an example of adaptation, very slow adaptation. Practitioners, health workers in a service, when you get overloaded with clients, you may adapt and change how you work to work a bit more efficiently or quickly or do things differently. So in a complex system, and that's the key thing, your agents adapt and change. And the system as a whole, therefore, adapts to the context. The control of the system is distributed out into those agents. There is no central controlling agent. In an ecosystem, some might disagree, but in an ecosystem, generally you haven't got one little animal in the middle directing everything that happens and knowing everything that happens. It's just something that happens because of the way all of the partners in the system interact. There is no central control. A property of a complex system where you've got adaptation, interactions, distributed control is it starts to self-organise into patterns, and from there you get new events emerging. And emergence is a key factor in a complex system. And with emergence, that's where you get change from. And so it's not cause and effect. You have 130 different factors or more interacting and changing, and all of a sudden, poof, something new comes up. Right. As a result, it's unpredictable. And you may get change that's really useful, but equally you may get change that's really harmful. You can't predict what that emergence is going to lead to or what the change is going to be. And it's driven often by adaptation to the environment or the context, to what you might think of as outside your system. And so it's what we call context sensitive. So you want to change the system, you can change the environment it's in. Examples of complex systems then, to try and illustrate that point. Cities. You have town planners, but there's no one that's like this is New York from the Staten Island Ferry, and nobody has sat there and going, we're going to put this building here and that building there, in 15 years' time there'll be space for this building, and then we're going to build this new tower over there in 25 years' time when they've got the technology. It just emerges. Someone decides, I'm going to build a building, and they build it. Then someone else builds a building, and it just happens to emerge from those decisions. Social networks, right? They're emergent. No one's sitting there thinking, well, sometimes you do design a social network, but often they just arise from interactions and common purposes. The weather patterns, and one that most people will know of, flock of starlings, and they form these patterns. And the patterns are emergent phenomenon. Interestingly, they've done computer programs, you've probably heard of this, with starlings, or what they call Boyds, not birds, because it was an American, the computer program. And you can explain all these beautiful patterns by 3 principles, just 3 principles, right? And they basically are that the birds have to fly the same distance from each other. And I think it is the same altitude, and they're always heading towards the middle. And if you program in a computer program for your objects to do that, they will form these patterns. The really simple rules lead to these complex patterns, depending on what the starting arrangement is. So that's kind of complex systems, and I think the next 2 slides are the most important ones in terms of what we're going to talk about today. Managing complex adaptive systems. How do you manage them? Shared big picture, goals as a sense of direction, distributed leadership, encourage variation. We often hear about the problems with variation across different DHBs. Variation's good, because that's where your new ideas come from. There's good variation and there's bad variation. Those services or DHBs that are varying in a negative way, try and stop that. But the ones that are varying in a positive way, You know, that's great. What are they doing? Yeah, let's build on that. Let's try and do more of that. Trial and error experiments. Just try stuff, because you're not going to be able to predict what's happening. So just try stuff and see what happens. Monitor it really closely, evaluate it, amplify or dampen. If you don't like the outcome, if it's not going in your sense of direction, dampen it. If it is, amplify it. And so anti-complexity. Here are the things that you look for, which tells you that your system is not being managed in a complexity-friendly way, and you may get into problems. Top-down control. Specific goals and targets, and plans to close the gap between where we're at and this new target. It's fine for complicated systems, not for complex systems. Centralised and expert decision-making, because usually in a complex system, no one's been in that situation before when you take into consideration the context. So you don't have experts. You might have people who know about the process, but not experts in terms of what the outcome is. Lack of input from the interface of the system and the context. And in this case, we're talking about lack of input from the health workers and the people they're working with, because that's where your change is going to come from in most occasions. Which goes to what we've heard so much about today, about the need for consumer input into change, being privileged. Extensive planning phase prior to implementation, because it's just a waste of time. Lack of use of safe-to-fail prototypes and heavy use of constraints. Constraints are really important, but if you overuse them, authoritative control, micromanagement if you like, one, you're going to get resistance, and two, you're going to stop variation and therefore stop innovation. So, kind of talked about the framework, and what we're going to do is look first at exploration, and then we're going to go down the complex arm, and there's a whole complicated arm we're not going to talk about because we don't have time, and it's part of the planning and part of the framework we're looking at. First thing is pre-change, or as Robyn suggested, it's called organisational capacity for change, if you like, preparation, whatever, shared vision and goals, alignment of the system and community culture. So your context and your system should be aligned as best possible. Quality of communication is really crucial. Levels of trusted management and supervisors, attitude of top management towards change, staff participation in decisions, identification with staff with the organisation, lack of conflicting values and beliefs, and low levels of politicking and game playing. Those are all the things that support a system that's ready to change. Right. And I know lots of systems and teams that are like that, and I know lots that aren't. And those that aren't really kind of need to up their game, do a lot of work on their own communication styles and their own ways of behaving. There are a whole lot of measures. How do you measure readiness to change? I looked through all of them, and most of them, their sensitivity and specificity and reliability is really poor. Most of them are just not up to scratch. They're not measuring what they say they're measuring. There's one that seems okay. If you want to use them, you can choose which you use, but the only one I think that seems to be reasonably reliable is the TCO, Texas Christian University Organisational Ready for Change Scale. People know a lot about that, I think, from the addiction sector anyway, because we've been sort of used that a few years ago in a lot of services. And it's also worth mentioning too, one of the big problems we get in services is this, the complexity cycle, and it often comes from trying to manage complex systems as a complicated system. This was designed for health workers thinking about what's happening with their work, and so we talk about cognitive overload, but there's any way of stressing a system. And what you get is the system will then narrow its focus down to what its core tasks are, and its culture will also narrow down. So if a service, one problem we've had in the alcohol and drug sector is that contracts have been for alcohol and drug outcomes. So when that service gets really stressed and you start talking about person-centred care and CEP to that service, a lot of services are going, well, actually, we're really stressed, we're only contracted to provide alcohol and drug treatment for this number of people, for this duration of treatment, so that's what we're going to fall back on doing. And it's kind of a big step back from what as a sector, we're actually trying to do. So you get that narrow focus, and then you get disconnection from other services, because you've got your narrow focus. The service that you might often relate to has also got its narrow focus. They've got their own cultures, and you get fragmentation of services. And we've got a lot of that. That's why people always talk about integrated care, right? Because everything's disconnected. That's where you get the silos from. So it's really about those kind of things. And the key to managing silos and complexity, and the more silos you've got, the more agents you've got, the more complexity you've got in the system. It just goes round and round. And the key is, one, relationships, but two, shared goals. And basically, one of the big reasons we get silos in health is that actually services are not working driven by common goals. They've got their own specific goal for their service because they treat alcohol and drug problems, or they're an early psychosis team, and their culture and their goals are different. And that's encouraged by their contracting to some extent as well. And no one's really working towards a common global goal of overall social well-being, if you like, or quality of life for individuals. Exploration. Two distinct types of change. The first way of looking at it is, one, there's a problem. We've got a problem, we want to solve it, or there's a solution. So, for example, there's a new intervention that's got an evidence base, or that a randomised controlled trial or meta-analysis preferably comes out and says this intervention works really well, and that's a solution, and you want to implement this new solution. So you've either got a problem or a solution. Two distinct types of systems, complicated and complex, and how you manage it depends on those interactions. And talking about complicated and complex, this is the Cynefin framework, which I think is really useful to use, whereby they've divided complicated and simple up. That's a linear approach, a linear side of things, and there's often not much difference between simple and complicated at that interface, right? Really, we're mainly thinking about complicated in health. On the other side of that divide, there's complex systems and then chaos. Chaos I'm not going to talk about, because if you end up being in chaos, just scream and ask for help and run away. Like, it's way beyond us. That's where you actually need a real expert to help you get out of chaos. You just try not to get into it. It's difficult. But really, you've got complicated and complex are the two main ones we're dealing with, and you've got this little space, the green bit in between. They call it liminal. It's kind of a boundary where you get systems that you're not sure, are they complicated or are they complex? And maybe they're a bit of both. Maybe some parts of the system is complicated and some parts are complex. And so when you've got that kind of problem, you pop them into that. In the middle is disorder. That's when you haven't got a clue what's going on, but it doesn't look like chaos, so you put it in there until you know what's happening. It's a bit like a diagnosis not otherwise specified, which means we don't know what's going on. We think it's this. So I've said that. To make things a little bit clearer, in number one, simple. It's everyone knows how to do it. It's like making a cup of coffee. Everyone knows how to make a cup of coffee. It's simple, right? In area two, someone on your team knows how to do it, but you don't. It needs some specific expertise. It's still linear, right? But it's quite hard. You might not know how to do it. There's an expert around who does. Number three, it's actually getting a bit messy. There may be somebody outside your organisation or your team, but not many people you know how to fix it, but it's still complicated. 4 is complex. 5, it's really complex. And to give you examples of what might fit in there, number 1, a simple would be processing a referral. Right? It's really straightforward. How do you process a referral? Your team's got a way of doing it. Everybody in your team will be able to do it, and you just process it. Next step up, number 2, complicated, screening for mental health problems. Right. So some people might not know how to do it, but there is a way of doing it. Someone will know how to do it. It's pretty straightforward. You go through A plus B plus C plus D equals your screening. Number 3, more difficult, structuring a comprehensive assessment. Some people who learn comprehensive assessments do it very structured and very complicated. Down the track, it's probably even moving towards 4 because you're kind of winging it and you're adapting it for the person that you're seeing. So you're making these adaptations, you're kind of doing your own thing a wee bit. Number 4, implementing a new model of care and a service. That's getting quite complex. There's no real rules how to do that. A lot will depend on your environment. Number 5, implementing person-centered care across all mental health services. That's really complex. I would say that's almost chaotic, having tried to do that with CEP and failed miserably. But those are examples of the different degrees of complexity or complicatedness that might fit. So what we're going to do is, we're going to forget that decision tree. We're going to get you to try and tell the difference between complicated and complex systems as the first. And in the nature of complex systems, it's really pragmatic, right? And there's not huge detailed algorithms. intuitive, and as I said, just what works. One really good way of looking at it is the frog and watch test. Right? If you break an object into its component parts, then reassemble it, will it still work? Right? You do that with a watch. If you're a watchmaker, it's not simple, I couldn't do it, but if you're a watchmaker, you can break it up into all its parts, shuffle around, look at them, build it back up, it'll go like a watch. Do you reckon you can do that with a frog? It's not going to sit there after you've done that and go greedy and jump away, is it? Right. So that's complicated. So one way of looking at it is, can you break it down and put it back together again, and it's still going to work properly? If it's not going to work properly, there's something in the interaction between the component parts that is really important, and you've lost by breaking it down. Right. And if you can, then it's more about the elements, and it's fairly clear how they interact. It's not variable, and it's reasonable. And so in the exploration phase, I'll skip through this because it's just a nice picture, but it doesn't mean much. First thing, establish a small initial leadership group with legitimacy. Assess the state of the system. Define the system, its boundaries, its key features, and its agents. So if you're looking at, I work in a child and family community team. My team would be bounded by this. It's not inpatient. It's not a group therapy team. It's on half of Canterbury. So that's the boundary. It's composed of these individuals in the team. So that's how I would define the team. And is it simple or complex? Is it complex or complicated and simple? You know, and that's the decision you have to make. And often if it's in the middle, it's neither one or the other. Is there a problem or a solution? If you've got a solution, you really need a complicated system, not a complex system to put it into. Right? That's one of the big problems we've got when we come up with ideas for solving problems, is that's fine, but to implement it properly, you're going to need your system to be a complicated system where you can put this into the middle of it and it'll still work okay. Because it's probably not going to do that particularly well in a complex system. You'll get weird things happening. So is it a problem or a solution? Decide how to approach the change. Treat it as complex, or constrain the complex system into a complicated system, or treat it as complicated. And so I think if you've got a system that's in a five, right, and it's really, really complex, it's going to be hard to turn that into a complicated system. But if you've got anything in that green borderline area, or even slightly to the complex, you may be able to move that into a complicated system, which may make managing it a lot easier. The difference, the key difference, other than what we said before, between a complex and a complicated system is the nature of the constraints. Complex systems don't have a huge number of constraints. Complicated systems have a lot more constraints. Right? So to be a clockwork mechanistic system, you need to have lots of rules and processes and policies, and people need to be following them. So it's quite constrained. Right? So one thing you can do is add constraints to a complex system to make it complicated. That means traditional methods of managing and predictability are much easier. And then you've got to decide, is it with all this in mind, do we proceed with the change or not? And then you organise the next phase, which is an implementation team. So that's what we're suggesting with exploration. And so we're going to do exercise 1 now, and I'll let Terry take over and run that.
We're moving to the close of the day, but we just wanted to say that really this afternoon has been a taster, that it's also been part of the plasticine man or woman or image that we're looking to shape. So we're really pleased that you're still here and that you're helping us with that project. Can I also just say that on your seats, hopefully, or at your table, your places, there's an evaluation form for the whole day, So if you weren't here this morning, feel free to tick this afternoon twice, as long as it's a good response. But on the way out, there's a box for those evaluations. So your evaluations are really important to us. They'll help shape potential future workshops. They'll help shape potential future seminars. It'll help shape us in the various workforce centres on where we go. So we really appreciate that feedback. The other thing is, we said before that the slides will be available. If we will email them out to all those who... So on the Tapo website, you'll be able to find today's proceedings and particularly the slides. Yep. So I'll remind you at the end, because I know you're keen to get on to the next bit, but your evaluations are very much appreciated, and for those who are worried about the slides, they'll be on the Tapo website. So this afternoon, as we, the last sessions, we started to introduce the EPIC, a model which incorporates, if you like, the strengths rather than the differences between various models that many of us have used or seen around transformation and change. We've started to explore, and we've started to look at some of the processes, and particularly thinking about, music. Music die. Thank you. You can hear me, all right. So, before the earlier sessions, we started to track the difference between particularly complex and complicated systems. Our exercises really got you, I hope got you, to start thinking about the different scenarios with complex and complicated in mind, thinking about constraints, the kind of constraints that not only enable systems, but also those constraints that potentially have negative impacts. And sometimes our reasoning around those are also equally important. I think one of the tables down there also talked about some of the unintended consequences sometimes when we start to constrain systems. Now this afternoon we're going to move into the next phase, as Fraser explained in the early parts of the presentation, that quite often when you start to move into this phase, it's a chance to do some rapid fire testing, if you like. And so important part of that, of course, is how you plan those, how you monitor those. So Fraser's next part is going to explain that a bit more, and then the exercises we're going to talk about, we'll take that a step further. So, kia ora, Fraser.
Kia ora, Terry. So, we're now looking at planning on the complex side of things. On the complicated side of things, right, you may want to plan what your destination is, where you want to get to in detail, and how to get there. That'll kind of work for a complicated system. What will happen with a complex system is it won't work. You won't get there. You'll get unpredictable results. So what we're suggesting is that planning involves planning the process, but does not involve planning the target or outcome. Right? In a complex system, you shouldn't really have targets. Right? You've got a goal which is a sense of direction, so you know whether you're moving towards it or away from it, but not specific targets. Because as I said, you'll get completely different results, but you'll also not monitor the process adequately to actually know whether you're on track or off track. So we're going to talk a little bit about the planning phase within complex systems, bearing in mind that, as we're saying, there's a whole lot of stuff around complicated. We're just not dealing with that today, because you'll know most of that. I'm going to talk about that and skip over a whole lot of things, so we can get on to the iterative cycle or implementation thing. So basically what you're doing here is establishing an implementation team. And that's the team that can start to generate the innovations. It may be the whole team in a service, or whatever, but you're really looking at having people, especially at the edge, or what the traditional system would call the periphery, and a good number of them to brainstorm. And you're planning the process, which is what we're talking about, rather than the outcome, as I said, and planning strategies to deal with cross-cutting issues. So there's ways of doing leadership and so on for a complex system. The key, and we've got things detailed there, but I don't want to talk about that today. All I want to say, the key is that you need to have approaches that are consistent with working with complex systems. So your leadership needs to be consistent with a shared big picture. Goals is a sense of direction, not a target. Leadership from behind, if you like, distributed leadership. Encouraging variation, not squashing variation. Trial and error experiments. And then monitoring it really closely and squashing negative deviance and amplifying, I really like this term, positive deviance. Probably because I work with children and adolescents. Deviance is quite endearing. But anyway, so amplifying or dampening. And what the Cynefin model would say is it's really about doing, how do you do more of this and less of that? It's really simple. What can you come up with to do more of these positive things and less of these other things. So is it heading towards the goal that you've had? If not, stop it or alter it. If it is, good, amplify it. And avoiding the anti-complexity stuff, avoiding too much top-down control. As a leader or a manager, you're going to need to have some control, and you're going to need to have control over the process. And so you're wanting to make a decision with the other people that you consult with about the process. But it's really about not telling the team or the organisation what they need, what they have to do in terms of destination, outcomes, and so on. Right? Again, centralised and expert decision making. Having experts on process may be useful, but having experts on the problem or the solution or where you want to get to is probably not going to be particularly useful in a complex system, because they've got expertise, but they haven't got expertise in this particular context. Right? And so on. The plans that we talk about, a leadership plan and a collaboration plan, communication plan, and so on. With complex systems, not all those plans are all that important. So because we're going to talk about interventions being safe to fail, what you don't want is to go and spend $1 million on a new IT system. Because if it fails, you've wasted $1 million, and that's not very healthy. Okay? So training. You're not really want to investing a whole lot of money at this stage on training, because if it fails, you've wasted a whole lot of money and time on training. Right? People are coming up with things that you think they can probably do. There may be a little development of skill that you might need, but you're not having big plans around those things. With leadership, just briefly, ensuring the appropriate process, developing shared goals to give a sense of direction. So this is all consistent with how to work with a complex system. And it's very much aligned with adaptive leadership. That's the leadership that Robyn talked about, as opposed to technical, which is more consistent with a complicated system. Technical being you do these set things as a way to get to a set goal. The adaptive leadership is much more what we're talking about here. Distributed, leading from behind, encouraging what we call micro-diversity. So you don't want major differences within your system, but you want to encourage differences in terms of how workers do things. It's okay for them to do things slightly differently. They're going to anyway, but it's okay. So encouraging that, and then working out what are the good things that are happening and getting that to be amplified. And then encouraging what we call iterative cycle implementation, which I'll come on to. And collaboration, again, the key thing about collaboration is it needs to follow these principles. There are lots of ways of doing it. That's about your implementation team and who you're actually collaborating with. One thing that's often talked about is co-design. As I said earlier, there are really quite different ways of doing co-design. So it's not okay just to do co-design. You need to do a co-design version that will fit with the principles of complex systems. Right? There's other ways of doing it as well. So while we might talk about co-design, there are other ways of doing it. So collective impact is a way of relating that's actually really useful and is very consistent with these principles. There's other agile approaches and design thinking approaches beyond co-design. Cynefin has a sense-making process, which is similar but different. If they kind of do the common things, right? If they're that middle of those petals, that's going to be okay. They've also got different purposes. So problem-driven iterative adaptation has been shown to be really, really useful for cross-government department level big social change. Co-design is quite good at a service level, if you like. Collective impact is really good at a cross-service and a cross-sector kind of work. So they've got different purposes. So my point would be co-design is great if it's done well in a modern way. But there are other alternatives that are just as good. So don't limit it by going, we need to do co-design, right? Because there's other things that work just fine. And we've got equally well going great guns with a collective impact kind of approach. I'm not going to go into these things in too much detail. I was going to go on about training because I like training, but it's really not that big in this area. I'm going to talk about the iterative cycle. So iterative cycle, what we basically mean is just something along the lines of this. You do a trial, you evaluate it, and you respond by adjusting the trial that you're doing. Okay? PDSA cycle was along those lines. In complexity theory, systems theory, they talk about the OODA cycle, which is orientate, observe, orientate, do and act. That would be more complex systems friendly because the observe means you're taking into consideration your environment, where PDSA typically hasn't done that, but now PDSA is very much like UDA. So again, you've got different ways of doing this. The key here is that you've got to try something that's safe to fail, isn't going to bring your system down, it doesn't work. Half them won't work.
How long would a good kind of give it a go and see if it's working or not?
Right. Well, excellent question, and that was my next point. So the key thing is the length of cycle, right? And what you want is rapid cycles. It's really hard to go, you need to do this length of cycle. Where it was designed, and this is kind of long, it was initially kind of designed with Scrum, which is part of Agile, which is about implementing software design. They talked about 2-week cycles, which is hard work. I think a lot of things we do, you're going to need 4-6-week cycles, but not 12-month cycles, you know. And the traditional way of doing it often is months and months and months of planning and consultation and working out what to do and strategizing, and then working out how to do it. Right, and this is about come up with an idea and just do it. Do it quickly and evaluate it reasonably quickly. And your evaluation, we've got lots of KPIs, right? The services will all have lots and lots of measures and evaluation processes. Of this, what you don't want to do is burden people with more evaluation. And you don't want any evaluation that has to go away and be processed by experts for a few weeks before you get any feedback. You want the feedback to be really quick. So what this involves is rapid evaluation, and it's usually qualitative, and it's really simple. It's about, are you heading towards the direction that you want to go in, or are you heading away from it? Have you got problems arising? And the best way of doing that is talking to the people who are implementing it. You know, whether you do that once a week or once a fortnight, and you just go and say, sitting down and go, there's lots of ways of doing it, you know, focus groups or a whole lot of things. But you just go and say, is this going in the right direction? Are there any problems? No? Can we adapt it or change it to go in the right direction? And how? Okay, let's do that. Or no, stop. We'll try something else. Really simple. Because what you want to know is, are you going in the right direction? Do you need to put more resources and let it run, or do you need to stop it? Because you don't want it to take your system down. So it's really simple evaluation. And as with a lot of complex stuff, it's intuitive often, and it's really simple and pragmatic, right? You don't need a whole lot of numbers and stats. It's just, is it working how we want it to or not? Do we keep going or do we stop? And you just let it run. Because you really can't predict what the outcomes are going to be. And in a lot of ways, a lot of interventions are counterintuitive. A lot of outcomes are counterintuitive. You know, a really good example would be the whole issue of urban renewal, where people working out how do you help urban renewal and lift up the underprivileged areas, the low socioeconomic areas, recognise that growth, economic growth was the key to it. Right? So they stimulated economic growth, evaluated things in a traditional manner, and found out 6 to 12 months down the track that that was wrong. You know, it was growth, but what you had to do was reduce growth. And they made it all worse. Because stimulating economic growth, as we know now, increases the divide between the haves and the have-nots. And so you made it worse. So the answer, you kind of knew where to intervene with, but actually how to intervene was quite counterintuitive. What you need is to evaluate it really rapidly. You need to know after 2 weeks, not 6 months, whether things are working. So that's the plan with an iterative cycle. With safe-to-fail trials, so it's allowed to fail. Many of them will fail. You brainstorm ideas with a collaborative team with people at the interface between the system and the context, people at the edge, the periphery, as traditional systems will call it. It's often recommended to run several different trials at the same time. If you run one after another, you risk your context changing, and you won't know whether one's better than the other because your context will have changed. So run. Cynefin talk about 5. Get people involved who have expertise in other areas. Like if you want to work out how to change a an assessment process in an NGO, consider getting an accountant on your team just to see what they come up with. Might be absolutely bizarre. But different ideas, variation, are worth considering. So pollinate with different ideas. And contradictory approaches should be welcomed because they're safe to fail. If it doesn't work, and you're going to know that within a few iterations, you just stop it. So that's the idea. And what you'll find is that of those innovations, some will be useful. Right? And that's the way in complex systems that complex systems theory works to generate innovation, right? As opposed to the traditional way of doing it. So you need to do that from the periphery, so to speak. So the idea is choose something you think has a good chance. Don't choose just anything. You've got to choose something you think might work. The change must be observable. You must be able to measure it. You must be able to get a sense of it's going in the right direction. And you must be able to dampen it down if it goes wrong. Those are the key things to making it safe to fail. So I'm going to just skip over that and we're going to move on to exercise 3. Okay, we're going to move into the final little section. Just thinking at the leadership day for Addiction Leadership Day yesterday, there was a really, really nice example of distributed innovation. And Terry and I are both from Christchurch, and we had to work, so we weren't going to mention Christchurch. But Peter Glensaw yesterday, when we were talking about change coming from the periphery, and he's from Wellington, so it was good that he had that external view, mentioned the situation in Christchurch and the response, and the compassion and the flowers and all that response. And that all came from the periphery. It wasn't someone at the top going, oh, we need to organise this, and you go and get some flowers. It just happened spontaneously from people in the neighbourhood, primarily to start with, who just decided to do this. And it grew, and it emerged into something that Jacinda Ardern, God bless her, reflected back to the country and internationally, but it started with just people just responding. And it mirrored what happened in the earthquakes as well, where my situation, I didn't see anybody from some official service for a week. Everything that happened where I was community and neighbourhood. And so those are really good examples of how something starts on the periphery and can grow bottom up and become quite an influential intervention. So I thought I'd share with you just something, just showing how, or reflecting on that in terms of something that is distributed, comes from the edge, comes from the interaction between the system and the context, and just grows, and you get significant change. So, we've done all that. Continuation. Basically, everything in terms of sustaining and continuing change depends on stuff you've already done. There's no secret to, now we've got to this point, we've got to do these things to continue change, other than perhaps keeping your foot to the floor. As soon as you stop driving the change, it's likely to fall back. Okay? But most of it comes from stuff that you've done earlier in the process. So shared vision is really crucial. Communicating the evidence of the benefits of change right at the start is really important. Engagement of senior leadership in the change initiative. Again, early. It's really important. That'll influence the sustainability. Adequate resources. Exposing and resolving conflicts of goals and beliefs. We talked earlier about those opposing belief systems. Training of new staff, obviously, if you need to. This is not complex versus complicated. This is the sort of thing you need to continue any change, whether it's complex or complicated. One thing to mention, though, is that this is really about scaling up now. How do you take your change and implement it into other services? And given that in complex systems, your changes and your system is highly sensitive to context, if you get something that works in one system and you put it into another system, it may well not work, right? Because it works because of the context it's in. What you have to do is make it a complicated innovation And you kind of do that, you make it context-free. And the way that people suggest that you do that is that you take this innovation that seems to work and you keep on repeating it in very similar kind of systems until it stops changing when you put it into a new system. At that point, it's probably become context-free and you can start to scale it horizontally to other services, higher up, or whatever. The other point, and this is where the issue of the common features becomes really crucial, and we often talk about fidelity, the need, some people go, you can't do things with fidelity. You can't, especially in complex systems. If you implement something here in one system into another system with fidelity, it probably won't work because your context is different. But then there's also research that says if you don't do it as you were supposed to, it's not going to work. The key thing seems to be that there are core features, as we talked about before, there are core features that you have to do with fidelity. There are other features that you don't have to do with fidelity and you can adapt and that can help that change work in a new system. Problem we've got, and they could do it, but the problem we've got with a lot of research in health is that they don't identify what the core features are of their intervention. So you get models like ACT, CBT, going, the whole model is the model. We're going to promote this. Same thing with innovation in the implementation science. This is our model. We're going to sell it to you. Because people make lots of money and get lots of influence from promoting these models. But actually, there are core features. There's a lot of similarities, for example, between ACT and CBT. And it's those things, probably, that's what you need to implement with fidelity. But some of the other stuff you don't. You can adapt these things. So how much do you have to maintain of an innovation when you move it into a new system? Our research is not good at identifying that. And that's something that our research needs to start to do. You get some randomized controlled trials, and that evidence that's context-free and it's complicated and it may well not work in complex systems, which is why you often hear the comment, this randomized controlled trial is all very well, but the clients that I see do not look anything like the clients in that randomized controlled trial because our context is different. So there are things that you need to do around scaling up. This is an imprecise kind of thing, but it makes a lot of sense in terms of the complex systems thing. You need to make something context-free before you'll be able to scale it to other services easily. You need to do it with a degree of fidelity to its core features, but you also need to adapt it into the new context to some extent. Right. So that's the stuff around scaling up. Just trying to click this on. We've kind of finished what we wanted to say, and the final exercise is really about getting some feedback, so I'll throw that to Terry to take from here.
I was just about, as Fraser was talking, I was just thinking about a number of you will be familiar with when we have particularly overseas-based models brought to New Zealand, a number of our services, Māori, Pacifica, would all say, yes, but they don't have many of us living over there. And so do these things actually apply? And I think the key thing as we start to thinking about scaling up, certainly with Māori, is thinking about its applicability. And as Fraser said, there's probably some core features in there that which will fit. And we talked before about thinking about various constraints. Some of it is thinking about that localization and thinking particularly around will it fit this community of interest, whatever the community is we're working. So this afternoon, you've been helping us to not only look at an emergent model, a developing kind of framework rather, to think about the change. This morning, we particularly heard the need for not only change, but transformation. This afternoon, we've kind of gone down that space of the how to move to that place. So if I was to say EPIC, what does E stand for? Oh, this is back to the... Okay, one big voice. Well, the longer you fellas go, the longer you got to go to the airports. Okay, P. That team deserves a lolly. Okay, I. And the C must be? Continuation. All right. One of the things that's really, for those of us who are involved in training, of course, it's all very well, you do the evaluation at the end, lots of knowledge transfer. Go back then a couple of weeks' time and you realise actually there's no skills transfer whatsoever. What we're looking at is definitely a transfer from this here and now to the next stage. So we want to find out from you, and the facilitators will help you at the table, to think about how useful the concepts have been from the day. And what barriers to implementing the approach do you anticipate at personal and systems level? And I guess we're really interested in how easy you found moving through it, acknowledging that one of the constraints has been time today. And given what you've heard and discussed in the workshop, what needs to happen next, particularly in terms of thinking about implementation of a framework like this. So the next wee bit is over to you really, and the facilitators will facilitate to get your feedback on your thoughts about EPIC particularly, and I guess in thinking about the challenges going that we've got ahead of us as we think about those transformations and change. So if you have any questions, feel free to ask Will, who's standing up now, no, or any of the other facilitators. Kia ora, Will, go. The last hurdle you have to leaving, so kia ora tātou. First of all, as I said, that last exercise was very much useful for us, and we look forward to looking at that feedback. One of the things that we're undertaking to do with the feedback, not only from the last activity, but also during the day, is to take it, look at it, how it will shape and reshape the frame that we're developing, the way, I guess, that we start to communicate a useful framework for those of us, or those in our sector, to be able to use. Because again, if it's too complicated and people don't get it, no one will use it, even if it's good. So we're really going to value your feedback. Now, one of the things that will happen is the slides will be available, as we said before, on the Tapo website. The other thing is that Fraser's undertaking to, again, based on the feedback, do some reshaping, and that'll be made available at some stage. I'm not going to put a time frame on it, but just to say soon. And so today doesn't really stop as you walk out the door, but there's opportunity to pick up and keep moving. I think, as a number of you said today, today's been quite fast. It's been a cognitive download, and so there's lots of stuff here. And we want you to go away and think. And if down the track you have some thoughts, we'll welcome those thoughts once you've had a bit of space. But also, I think it's very much an iterative thing as we go. There may be opportunities again to feed into our process. So I definitely want to mihi to you, to one, for staying, two, for the participation. We've been really impressed as we've listened and seen the level of conversation and discussion happening. So we really want to acknowledge all the wisdom and knowledge you've shared with one another. To our facilitators, big ups. I know we kind of end up dropping you into it in the end, and again, going around, I want to thank you all for helping those at the table, but also helping us as we develop. Big ups, big props to not only Te Pau Whakaaro Nui, Matua Raki, Werry Centre Whāraurau particularly, and also Te Rauora for letting me be here, for that sense that we're all committed to that transformation going forward, and for those who have really made this day happen. I really want to acknowledge all the work that's gone into. Jenny, big ups to you and big props to you for herding the cats and bringing us to this place, and for all the work you and also the team have put into bringing us here. So kia ora tātou. Process from here, as I said, is we're finishing off. We're going to hand it back to Josiah there, but the information and the work that you've done today will be available at a later date. Can I just say to those of us who are travelling this evening, wherever that may be, go well and go safely. Earlier on, I heard of some late arrivals who came into Wellington to land, and as they came into land, they took back off again, ended up in Palmerston North and bussing down to be here especially. So, I hope none of that happens to you, especially if you're going south. Going to Palmerston North and catching a bus isn't much fun. But again, safe travels, everybody, and whatever higher power goes with you, go well. And on behalf of Fraser and I, kia ora tātou at this stage, we'll hand it over to Josiah to bring us back to our program. Nō reira, he mihi atu ki a koutou, tēnā koutou, kia ora tātou.